Our vision. It's how we connect with our world, our loved ones, and it's how we navigate our daily lives. But what happens when our vision is compromised? Geographic atrophy, or GA, is an advanced form of dry, age-related macular degeneration, or AMD, that leads to irreversible vision loss. If you have GA, you are not alone. 1.5 million people in the US have GA. In fact, 67% of people with GA in both eyes can lose their ability to drive in 1.6 years. And within 2 years, 50% lose 2 lines of vision on an eye chart. Given how quickly it can progress, every month matters when it comes to slowing the progression of GA. But just what is GA? GA is a disease that affects the retina, which is the part of your eye that converts light into signals that your brain turns into images. At the center of the retina, the macula helps you see detail. At the center of the macula, the fovea is responsible for your sharpest and clearest vision. When dry AMD progresses to GA, cells in your retina die. This leaves behind patches of dead cells called lesions that can spread and cause vision loss. GA's progression can be fast. In as few as 2.5 years, lesions can spread and reach the fovea, leading to irreversible vision loss. There's something you can do to slow down GA. Ask your doctor today about IZERVAY. IZERVAY is a prescription eye injection used to treat geographic atrophy, GA, the advanced form of dry, age-related macular degeneration, AMD. IZERVAY is proven to slow GA progression, which may help to preserve vision for longer. IZERVAY was evaluated in 2 clinical trials of over 700 people with GA. In both trials, GA progression was slower for people receiving IZERVAY compared to those that were not treated. In Trial 1, IZERVAY slowed progression by 35%. In Trial 2, IZERVAY slowed progression by 18%. The most common side effects include blood in the white of the eye, increased eye pressure, blurred vision, and wet AMD. IZERVAY works by targeting a key source of retinal cell death and loss of photoreceptors. Here's how. With GA, part of the immune system becomes overactive. As a result, a protein called C5 signals other proteins to start attacking retinal cells. IZERVAY blocks the C5 protein to help protect healthy retinal cells and photoreceptors. IZERVAY is an eye injection given in the office by your doctor. To receive the full benefit of IZERVAY, you should follow your doctor's recommendation for continuous treatment. When starting a medication, you may have questions, need support, or just want to learn more. IZERVAY Vision Points is a free educational program where you can learn more about GA and IZERVAY. If you need help with the cost of IZERVAY, the IZERVAY My Way Financial Assistance Program may be able to help. Our vision is how we navigate our lives. If you have GA, it's time to act. To slow progression of GA, start today with IZERVAY. The earlier you act, the more you may protect for longer. To learn more, ask your doctor about IZERVAY. Do not receive IZERVAY if you have an infection in or around your eye, have active swelling in or around your eye that may include pain and redness. Eye injections like the one for IZERVAY can cause an eye infection, endophthalmitis, or separation of layers of the retina, retinal detachment. Call your healthcare provider right away if you have redness of the eye pain, increased discomfort, worsening eye redness, blurred or decreased vision, an increased number of small specks floating in your vision, flashes of light, or increased sensitivity to light. There is a risk of developing wet AMD with IZERVAY. You should report any symptoms, visual distortions, such as straight lines seeming bent, deterioration in vision, dark spots, loss of central vision, to your healthcare provider to monitor. IZERVAY may cause a temporary increase in eye pressure within minutes after the injection. Your healthcare provider will monitor this after each injection. Before receiving IZERVAY, tell your healthcare provider about all of your medical conditions, including if you have a history of seeing flashes of light or small specks floating in your vision, and if you have a sudden increase of size and number of these specks, have high pressure in the eye, or if you have glaucoma, are pregnant or breastfeeding, think you may be pregnant, or are planning to have a baby, ask your doctor for advice before taking this medicine. Are taking any medications, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Tell your healthcare provider about any medicine you take. Your vision may be impaired after receiving an eye injection or after an eye exam. Do not drive or use machinery until your vision has recovered sufficiently. The most common side effects of IZERVAY are blood in the white of the eye, increase in eye pressure, blurred vision, wet age-related macular degeneration. These are not all the possible side effects of IZERVAY. Tell your healthcare provider about any side effect that bothers you or that does not go away. Call your healthcare provider for medical advice about side effects. You may report side effects to the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. Please see full prescribing information for more information.